Healthcare really enticed me because of the long patient times and patient appointment times. And so I feel like I am not setting myself up for burnout with the 15-minute, 20-minute appointments back to back to back. Sure, it'd be a great experience and it might be fun, but I feel like I'm going to be able to grow more as a nurse practitioner and to provide better patient care and to develop those relationships with patients, which at healthcare we do and we can because we have that time to be able to talk with patients and to be able to get a good history and to have good discussions with them and to develop a plan that works for them.
Hey, this is Aase from HELPcare Clinic. We're excited to welcome to the podcast today, Take Charge with Healthcare, our newest nurse practitioner, Kristen Ehmke, who's been working with us for a little while as a nurse, but is passed her boards now and is ready to start seeing patients as a practitioner, the fifth of our practitioners. So we've had four up to now, and Kristen is the fifth. So we're glad to welcome her and Dan to have you run the interview, and then I'll kind of chime in as we go along.
Yeah, it's great to be on the podcast today with you, Lee, and excited to have Kristen join us. So, Kristen, why don't we just start by you telling us a little bit about your background, where you grew up, your education, your interests, anything you'd like to share with the podcast audience.
Sounds good. Well, I grew up in Blooming Prairie, so just down the road from Austin. I've been a registered nurse for 12 years with experience in all sorts of settings, inpatient, outpatient, pre-op, post-op, long-term care. So quite a variety of nursing background. And of course, at healthcare. I graduated this past May from Augsburg University with my doctorate, a nurse practitioner. So I am excited for starting this next journey of working as an NP with healthcare.
Wow. So tell us about why nursing. What drew you to that profession?
You know, my mom is a nurse practitioner. My sisters are both nurses. I have always wanted to work in health care and helping people, which is, the normal answer. I want to help people, but I want to help people improve their health. So not just help them in general, but to help make a difference with people's lives.
Yeah, and so what opportunities have you found to do that so far in these 12 years you've been in nursing? Any particular experiences that stand out for you?
Probably what is most standing out to me throughout my doctorate program, I led a study, mindfulness meditation to help reduce anxiety and depression symptoms for people who live in rural communities. I have had a great love for caring for people in rural communities just because we don't have the resources that bigger communities do. So that really stood out to me to make a difference.
Well, I love knowing that about your background, mindfulness. What
Yep.
part does that play in the healthcare journey?
We use mindfulness every day, especially in healthcare as nurses when we simply take a deep breath before we walk into a patient room. It's like an internal reset. And so we don't know we're necessarily doing mindfulness meditation, but we are.
Great example. I really love hearing that. So, what made you decide to become a nurse practitioner after all those years as a nurse?
I wanted to become more involved with patient care and to be able to make more of a difference with being a patient advocate and helping patients to choose a plan of health care for them and a plan that works best for them in their lives right now.
So maybe that leads us to the healthcare experience, right? So, well, Lee, why don't you jump
Yeah,
in
I'll
for
just
just a minute
say,
and
yeah.
say, yeah, what attracted you to Kristen?
Well, Kristen filled out a form, or actually sent us an email through the website, through our careers page, and it expressed some interest in getting together. And it said she'd been kind of following what we're doing, but was interested in talking about it. And we got together for coffee, and actually at the same coffee shop where Dr. Dave and I got together to start this whole HELPcare Clinic thing in October of 2019. And I just say we just hit it off. I mean, she was very much aligned, very much in sync with what our philosophy is of how we really want to equip and train and empower members, our patients' members, build those relationships with them, and recognizing that the most important thing that we can do is help them to take charge of their health, that it's not about what they do in the office, in the doctor's office, it's what they do when they're home, and giving them the tools. And I could just see Kristen just really resonating with that, kind of all along. So she came to visit us and spent a little time in conversation with each of our practitioners. And just through that conversation, I think we saw definitely a meeting of the minds of a common commitment to the purpose. And so we were super excited when she said yes.
We've talked before on this show about the importance of culture at healthcare, right? And how it's really one of the key things that draws patients to the organization is the fact that culture is aligned, people care, people collaborate on the same lines. And so as you got to know healthcare, Kristen, what was it that really drew you to the organization?
It felt like a family. So all of the staff knew each other very well, it was very welcoming. Even the first time I went in there to meet the practitioners and I met with the nurses and the staff, it was just like a homey environment. I was like, okay, I could fit in here.
Yeah, I think she actually knew. Kristen went to school with one of our nurses, who also happens to be my daughter, back in the before she started her 12 years of nursing. One of her classmates was my oldest, or my middle daughter, who also was a nurse with us. And she knew another of our nurses, and so I think she had a predisposition to feel like this was a good kind of family environment.
So tell us, for those of us who don't fully understand what the difference is between a nurse and a nurse practitioner, tell us a little bit more about that. What are you able to do now as a practitioner that you couldn't do before?
So as a nurse practitioner, I'm able to have patient visits, to prescribe medications, to provide counseling and support for patients, caring for chronic healthcare management, as well as acute conditions. So I'm stepping into, it is a mid-level position, so similar to a physician's assistant, and nurse practitioner is right there, right next to them.
Yeah, so what she really does is she'll really increase our capacity to be able to give more timely care to patients. We give timely care to patients already anyway, but also just to grow the practice because, as we're having new members, we want to maintain that relative proportion of the number of practitioners to the number of patients so that they can have those relationships. They know the practitioner knows them. They can be seen in a timely manner and also can have those unhurried office visits that are really kind of part of our trademark, I guess, is that there is that personal unhurried care and in a place where you're a member and not a number, and so Kristen's going to help us continue to provide that level of care even as we grow our membership.
I'm intrigued by your interest, Kristen, in rural healthcare particularly. And would you be able to describe what the difference might be between providing healthcare in a rural setting versus in an urban setting? Is there a difference with that?
There is. My project with school, I really dug deep into the research between care accessibility in urban settings versus rural settings. And I grew up in Blooming. I lived in Brownsdale, now Hayfield. So I'm a homegrown rural community member. And there's limited access to care. So in rural communities, patients don't have quite the accessibility to as quickly like acute care. There's availability, but it's not quite as much and readily available as it can be in urban settings due to the limited amount of healthcare organizations in one.
Well, yeah, I'd also just say that, Dan, living out in Seattle, wouldn't appreciate those three communities that she just mentioned, but they range from about 500 to 700 people to 1,500 or 2,000 in
Yeah.
population. And so those are the kind of communities in southern Minnesota that used to have their own clinics. They used to have a doctor's office in the small town, and they don't anymore. And that's part of what we're trying to do with HELPcare is really be able to make that care more accessible to people in those communities. Right now we're in Austin and Rochester. We're looking at being able to be in some other communities as well. But we're trying to restore that old-fashioned doctor's office, where you could go in and just be seen locally and really have that relationship where you know your practitioner and he or she knows you, and to make it economically viable to have those small town doctor's offices. And so we're excited to have Kristen, who has this real heart for this in the first place, to be joining with us. And who knows what we'll end up. She's starting practicing in Austin, with our Austin practice. But as we look to expand in the future, maybe there'll be a clinic in Hayfield, which is her hometown. Like that'd be kind of neat if we would be able to do that.
Yeah.
Well, it's not her hometown, it's where she's living now.
Right.
Blooming Prairie would be her hometown, but yeah. We've had other practitioners join us who've talked about being burned out in the regular healthcare system and how this is not what they signed up for in the first place when they went to school. You're coming at it from a different angle. Yeah, and
Yep.
you've been in the regular healthcare system as a nurse, but not as a practitioner. So why was that important for you to be joining a clinic like HELPcare Clinic right out of the chute instead of having the 15 to 20 patients a day that you'd have in another practice?
So healthcare really enticed me because of the long patient times and patient appointment times. And so I feel like I am not setting myself up for burnout with the 15-minute, 20-minute appointments back to back to back. Sure, it'd be a great experience and it might be fun, but I feel like I'm going to be able to grow more as a nurse practitioner and to provide better patient care and to develop those relationships with patients, which at healthcare we do and we can because we have that time to be able to talk with patients and to be able to get a good history and to have good discussions with them and to develop a plan that works for them.
I also think one of the great things that you've already experienced in your time as a nurse with us is just the mentorship of having Dr. Strobel. Because I've heard him call you out sometimes and say, hey, I'm looking at this record. What do you think about this? Or what do you think about this patient case? And so I think that's going to really help you grow as a family practice nurse practitioner, because that's your specialty. I mean, you're a doctorate in family practice.
Yep.
To be able to work with somebody who's been in that role for 30 years, and also has learned a lot, even grown in the last 10 or 15 years, he would say, in his approach to managing some of these chronic conditions. Kristen, how's your experience been? What most stood out to you as you were working as a nurse at HELPcare Clinic, and how has that differed just from the nursing perspective compared to some other places where you've worked?
There's been more time, which has been nice, and more time for patients is what I've noticed, and that has been really nice. Even with like the rooming process, we have time to, discuss a little bit with the patients as we're getting our vitals and all of that, and seeing for updates as well as through like the virtual communication. We're able to easily communicate with patients, and that's been very nice, very smooth.
What would you see as your vision for how things might develop for you with HELPcare Clinic and with your role as a nurse practitioner? Where would you like to be, 5 years from now, 10 years from now?
In 5 to 10 years, I would like to have a panel of patients that I am their primary care provider, to be able to get to know patients and their families, similar as you have talked about the traditional healthcare model where the provider knows all the children of the family or and the parents, and you get to know these patients and certain things about them and their lives. And so when you're developing plans with patients, you know what's realistic and really, I'm excited for myself to continue to grow as a nurse practitioner, to be able to really dive deep into interests that I am interested in, such as like dermatology, different skin conditions that I would like to become more of an expert in. And hopefully I can help patients with that too.
Yeah, I think you've mentioned you before when we had our initial conversation. You said that, and with the other practitioners, you talked about that as an interest, and I think that's one of the things that really sets HELPcare Clinic apart as well is the opportunity, because you have the time for specialization without being formally a specialist. You're not a dermatologist, but you can have this special area of interest where you've done some work perhaps previously as a nurse, but that's an area where you would like to be the one who's able to provide extra care that could be done for other practitioners, patients as well. That you could kind of become the go-to person on these topics.
Kristen, is there anything else you would like to share with us, either about your background, your experience at healthcare, or your hopes for the future?
I am hoping that I can bring in different experiences and knowledge that I've gained throughout my nursing career into my skills and patient visits so I can bring my previous knowledge to healthcare and continue to grow.
Well, we're so glad to have you with us. I mean, we recognize that you've had a lot of really great experiences so far, but just you're a generation younger than our other practitioners. And so having you start with us and be able to bring that enthusiasm and energy, not that they don't have energy, but just to bring that perspective, I think will be really great. And your eagerness to learn and to grow will be something that I think will be a great asset for us. So we're excited to have you join us.
And thanks so much for coming on the podcast today, Kristen. We're happy that we can introduce you to our audience and also to the patients who'll be viewing this. So thanks a lot for that.
Thanks for joining us. If you enjoyed this episode, be sure to leave a comment or a review and to subscribe on Spotify, Apple Podcasts, or on YouTube. And also to share Take Charge with Healthcare with your friends and on your social media channels. At HELPcare, our passion is helping people take charge of their health and their health care, helping employers take charge of their health plan expenses, and helping physicians and other practitioners take charge of their healthcare careers. Learn more about the HELPcare Clinic difference at helpcare.health.